minus us doing the ambulances.
Okay, and John, just on that, John, in case you're not
I'm
running it,
listening.
I don't mean to interrupt in case you have more questions, but I couldn't print this from the agenda viewer on my own printer, so I had to come in here yesterday and print it. And actually, I did hit to print to the council study printer, and it printed right to that machine from home. So I just wanted to tell you that too, so if you ever print anything and you need it printed, you could run in here and grab it off that printer and just run in and grab it. You still have a key to this door, even if it's locked.
So I don't have a key to the store, I turn my
I don't think
key
it's
set.
locked very often.
All of our key, that key they gave us to come in the study room is the same for everybody, it didn't change.
Yeah, what I'm saying is when we were moved down the hall, I turned in all of my keys.
Well,
To who?
to who?
I turned them into it 4 years ago. Well, I'm lucky if I can remember what I bought yesterday.
Okay, well, anyway, so everybody, maybe Cindy can help us with that, make sure everybody has a key to that door too, because we're all supposed to go on, I think. So I thought that's what was done. I mean, I know that
Yeah, no, it's all we did was switch the keys to the
and
offices,
that,
because those were.
that opens
those were-
there, you have a key to that door, so you can come in here anytime you want and use that printer too, you still have your key to the study here.
That's what that key, that door, I don't believe I have a key.
But you have a key to that other door, because everybody kept their key, that's the council kitchen and whatever.
Oh, okay,
Yeah.
okay. But that's good to know,
And if you
that I
don't-
wasn't the only one denied access.
Yeah, I couldn't get
Well,
it
it's
to
like-
print, and when I hit print, I didn't realize it, but I got here and it was on the council.
The only thing I would say, Councilman Delo, is, I don't know the last time you were on the system, but it does require you to change your password every so often, but you're saying you didn't say that you needed to update your password, did it?
No, it just told me I was denied access.
And that's another thing I found out too, that if you don't turn your computer off here, it gets all messed up. So you have to turn it off periodically so that it comes back on and everything's hunky-dory.
Is that here,
Don't
was that
turn it
here
off.
or at home, John? You're denied, were you here when you got
Home.
denied? At home, yeah.
And here.
And here, yeah, so sometimes you just have to, Sneal told me that, just turn it off completely,
Okay.
yeah. But, all right, so now, do you have more questions, John?
Nope. Nope, thank
Anybody
you.
else have questions on this lease?
Madam Chair,
We did all just get it, so.
I came in late and I have not seen this. When I picked up my material, it wasn't here. And I was here Saturday. You guys may have covered it. Could you just go through real quick again for my benefit, the existence, how we're going to coexist with HealthLink?
I think mainly the idea here is the bunking for HealthLink. I don't anticipate that they're planning to spend a lot of time in common quarters, waiting for their to be activated. I think they're basically what they're doing right now is they're renting hotel space for bunk, and that's basically at the time of their shift that they want to go and try to get some rest. If there's not calls, then that's what they're doing. So this is kind of a replacement for that. Obviously, the inclement weather allowed them to get, those winter months, it allowed them to keep the vehicle out of the snow versus sitting in the snow or anything to that effect. So, but just from, to sit down with Chief Reynolds and myself and Diane, and go through the proper protocol and how we're going to handle any potential issues as they arise. And obviously our employees are always expected to maintain a certain level, as Mr. Reynolds indicated with the fire procedures, rules and regulations, as well as Diane has her own that they're has standards that they're held to as well. So we'll create a common approach to how that's handled in any situations that are dealt with in there.
And it's two, you weren't here when I asked, I was asking how many people we're talking about, and it's 2 of the HealthLink people and probably 4 of our people.
We're talking about a mixture. Obviously, I don't think we have any females left in our department. So, but with HealthLink, is it male and female? And have we addressed? And I see that there's a lease agreement here, but have we addressed just operational procedures related to the lease? Regarding I know they're sleeping there. I don't think they sleep in their gear. So those kind of things, have they been addressed anywhere or?
Not within the lease, no. That's something that, pending approval with the lease, that we would sit down with both of them. Diane Wachowski from HealthLink and Deputy Chief and I, and make sure that those proper practices are put in place. And both 2 and 3 have separate bunk areas, and, you know, so it's, I mean, they don't have doors up, but they're designated, they get full walls separated from the bunk areas, so.
Sure. How many bunks are there in each?
Well, the number was 12, I thought. It's typically with the 3 shifts, they didn't necessarily share the bunk area, even though they stripped their bedding, in case they did have some overlap. So it didn't cover guys that were alternate on shifts for each station, each location. But when we had 17, when we were up at 17, you had at least 5 assigned to each shift, each station, each location plus one or 2. The battalion chief would be one of those, and then battalion or body. So
Each station, just in case folks didn't know, each station does have separate showers and locker rooms for men and women.
well, 2 has I think a couple more than 3. I think 3 has 6 total, if I recall correctly. I think it's either 6 or 8, and then that might only be 3 on this side and 4 on this side, so it might be 7 total. But again, they would be assigned to, they would rotate their bedding, with the other employees related to working for HealthLink, and then our employees that per shift, they strip the bedding down, they leave, and they put cabinets that they put their stuff in, and then re-outfit it for the next shift, for the next guys that they would use it, so.
And the utilities, this paragraph, I don't know, these aren't numbered, but the paragraph about utilities, it's 8.3% is the portion that they're paying, is that correct?
Correct.
On top of their suite?
Correct.
And I'm not sure where'd that number come from,
1 bay and 2
just kind of dividing it.
berthing areas, sleeping areas, divided by the total square footage.